Good evening and welcome to Discover Monash, where we'll be discussing about our program of nursing and midwifery. I am one of the presenters, Kim Davey, together with my partner, Chris Scott, who will be presenting for the Bachelor of Nursing, and myself for the Bachelor of Nursing, Bachelor of Midwifery. Just to let you know that this presentation will be recorded and it will be available on the Nursing and Midwifery study page within the next 1 to 2 weeks. So welcome to you all. Before we get into the detail of this evening, I would firstly just like to acknowledge the country. So Monash recognises that it's Australian campuses that we're located on, and they are on the unceded lands of the people of the Kulin Nations, and we pay our respects to their elders past, present and emerging. And now I'll hand over to Chris.
Thanks, Kim. I'll just take a moment to quickly introduce our other people who are here, just to say hi. We've got a few guest speakers tonight. So we've got Georgia, who is a former graduate of our nursing and midwifery degree. We've got Megan, who is a graduate of our nursing degree. And we've got Sammy, who is a current third-year nursing student. They will be answering some questions later on. So thank you so much for coming, guys. As mentioned, my name is Chris. I am the course director of the Bachelor of Nursing, and we are going to start talking about this program. Please feel free to put questions in the Q&A as we go. Some of them will be moderated as we go, and we'll answer other questions at the end. So, nursing and midwifery, what is it about? I'm primarily going to talk about nursing and let Kim talk about the midwifery. But start by saying nursing is so flexible. Nurses do so many different things, and all these things, every time I look at these things that are written here, I go, I've done every single one of those. You know, caregiving, education, research, clinician, management, innovation, problem solvers. You can work in hospitals, you can work in clinics, you can work in the community. There is such variety in nursing, and it just keeps changing and expanding. Thank you. And this is just some of the specialties you can work in. Just looking through these, I am primarily an emergency nurse by trade, but I have worked in the military. I have worked obviously in education. I have worked in the prison system. I have worked in many, many different areas, and there is no limit to what you do. You don't come out as a specific kind of nurse. You can just go wherever you want. It is very flexible. Thank you. So, why study with Monash? I mean, we're not the only school. Like to point out, we are actually ranked #1 in Victoria for nursing. So according to the QS rankings, we are actually one of the largest schools for education of nursing and midwives in Australia. And this next one's really important. Our grads are highly sought after, and this is not something we say lightly. We meet regularly with our hospital providers, and they value our students. Our students come out well-trained, well-prepared, doesn't matter, nursing or midwifery, highly sought after, high employability. We're innovative and believe we have a degree of excellence in research and teaching. We adjust based on the current demands, requirements as based on our accreditation. Our curriculum is constantly evolving. We listen to our clinical partners. We listen to government. We listen to everything, and we create a course that makes you ready for the big bad world. Our lecturers are all lovely. All our lecturers are either nursing and or midwives. So we come from a profession of caregiving. So I feel our teams are very approachable. And we really have a focus on academic student engagement. It is not the kind of course where you never see your academics. Your academics are available. That includes your course directors like myself and Kim, down to your people who are supporting you through the course. Okay. So if you want to do nursing, here is our ATARs from this year. So as you can see, for the Bachelor of Nursing, we had an ATAR of 76.7 for Clayton and 71.35 for Peninsula. Please note the course is the same. It's not like the Peninsula is an easier course or anything. It's just Clayton tends to be a bit more popular, which is why the course is a little bit higher. And our scholars program, which we'll talk about a bit later, has a much higher ATAR of 90 plus, but you don't need to get into the scholars program to do nursing. Our course, the Bachelor of Nursing course, is offered over 2 campuses, so Clayton or Peninsula, as I said, and it's the exact same course. There is no difference. Content's the same, the academics are the same, it's all the same. It's a 3-year full-time course. The part-time pathway is 6 years, and there's some flexibility in that. And the entry requirements are you must have English, you must have VCE English, and you must have 1 VCE maths. Which maths doesn't matter, but you must have 1 VCE maths. Now, if you don't get an ATAR that gets you into nursing, there is a potential alternative pathway called the Diploma of Tertiary Studies, or DOTS. This is only offered at the Peninsula campus, and it's only for the Bachelor of Nursing. So if you do year 12, but you don't quite get the ATAR you need, you can enroll for this program, and the criteria are listed for the DOTS program. And what happens is you're enrolled in the Bachelor of Nursing, but you do 1 subject each semester that's different to the nurses. And it focuses on improving those foundational skills to get your level up to the nurses already in the course. Now, if you're successful in the DOTS program, which lasts for a year, you then enter 2nd year of nursing with the rest of the nurses. So you continue on with your colleagues, and it still only takes you 3 years to finish the course. So DOTS actually is the same length of time as doing the bachelor to start with. Okay. The other pathway, and this probably doesn't apply to most of you, but it may if you choose to go another way, is if anyone chooses to do an enrolled nursing program, which is the Diploma of Nursing, and you register as an enrolled nurse, you can actually go into it, what's called our direct entry program, which means you finish your diploma, which takes 18 months full time or longer. You enroll as an EN, you can apply for this program, and if you are successful, you enter the program at year 2. So you actually do the Bachelor of Nursing in 2 years instead of 3. However, this is only valid if you are an enrolled nurse with the Nurses Board of Australia. So if you choose not to go straight into a bachelor's degree and choose to do a diploma first, this is another pathway into nursing. However, I will point out, as the slide says down the bottom, it's a competitive process. So if you want to use enrolled nursing to do this pathway, you've got to be good. And the other pathway we had is the Bachelor of Nursing Scholars. So that's the one with a really high ATAR. So what happens with this one is it's still the Bachelor of Nursing program, but it's for those really high-performing, high-achieving students. And what happens is there are extra opportunities available around leadership, engagement, research, which actually is couples onto your nursing program, which helps you advance some of these more advanced concepts. So when you graduate, you've got, it helps you with pathways into advanced learning and research. Okay, so what are the aims of the course? The aims of the course are the very simple answer would be to create registered nurses. That is our goal. The goal of this course is that we will train you, so at the end of the course, you can register as a registered nurse and go and work anywhere in Australia as a registered nurse. So we do that by preparing you for the current workforce environment, and that is changing all the time. So we are constantly changing. We are not training you to be a perfect nurse by the time you come out, because that's not possible, because nursing changes all the time. We try to give you the tools and the skills that it doesn't matter where you go in nursing. You go into an emergency department, you go to a ward, you go to theatre, you will have the core skills so that you can then build up and become efficient and proficient in that area. Because nursing is just so varied. You saw that slide. There are dozens, plenty of places you can work. We cannot prepare you for every single one, and that's not even including midwifery, which Kim will, of course, talk about in a few minutes. But again, as mentioned, we do have good preparation of our grads. Our grads are highly regarded by industry. Just having Monash nurse actually does open some doors. I'll hand over to Kim.
Thank you. So for the Bachelor of Nursing and Bachelor of Midwifery honours, it is held via the Peninsula campus and is a 4-year full-time program. As you can see, for 2025, the ATAR was relatively high at 83.35. So there are certainly a number of requirements to meet that also align with the requirements of the Nursing and Midwifery Board of Australia. And certainly you need to have a VCE English prerequisite in order to enter the program, and also demonstrate English language proficiency as required by the Nursing and Midwifery Board of Australia. So this is part of the English language is part of the registration standard. Unlike nursing, there's not an essential requirement for mathematics. Sorry. So our course aims to prepare students both for the current and future workforce needs with an expanded and extended multi-skilled scope of practice within midwifery. So at the end of this program, you are able to qualify as both a midwife and as a registered nurse. But there is a strong emphasis on pathway to midwifery practice. And we prepare our nurses and midwives who can work across their full scope in each of those disciplines and in settings where dual qualification may be important as part of that person's outcomes. So that can be places certainly rural and remote, or some people are often keen to join the Royal Flying Doctors and places like that. So that enables that process to happen.
Okay, so what do we teach you? So noting on the nursing side, regardless of whether you do the Bachelor of Nursing or the dual degree, you will do the nursing side. So the Bachelor of Nursing will do the nursing, the dual degree will do both. So I'm going to talk about nursing first. So first year is our first year. So we teach you, we get you into the university. We start to teach you about clinical communication. We teach you about law and ethics. We teach you about or bioscience, anatomy, physiology, how the human body works, how to start assessing the human body, initial skills like how to take vital signs, blood pressures, heart rates, how to care for a patient, how to perform basic activities of daily living, how to do medications, which follows with a clinical placement. We'll talk about clinical placements separate. From there, you move into your second year in the Bachelor of Nursing, which focuses on more acute care. We start to move into medical, surgical, acute care. We talk about mental health. We start to talk about pediatric and family nursing, and we increase the acuity. And then in third year, we move into complex, high acuity care. We start to look at patients having, heart attacks and strokes and more serious conditions and the nurse's role in that. And we finish with a preparation for practice. We have a unit where the goal is going, right, you need to stop thinking yourself as that student nurse and start thinking yourself as that practicing nurse and making that pathway into industry. And I'll let Kim share on the midwifery side.
Thanks, Chris. So for midwifery, we focus very much on woman-centred care and family-centred care. The dual program obviously runs in parallel with the nursing program. So all that Chris has spoken about, you'll cover in your nursing component. In addition, for midwifery, you start your first unit for midwifery in second semester of first year, and that's an introduction to midwifery, which is a core requirement for people choosing the Bachelor of Nursing, Bachelor of Midwifery, and is also an elective for those who choose to do the Bachelor of Nursing. We also cover that into second year into normal pregnancy, birthing and postnatal period and care of woman and baby and family, and then continue on to more complex birthing situations. Into third year, we move into care of healthy as well as sick and or preterm babies, and also do some of our professional units as well. We cover quite a lot of pharmacology because we use very similar medications to those in nursing, but for different reasons. And we will also cover mental health and maternity care within that process of the course. And also in fourth year, we'll start to cover a lot of the obstetric emergencies.
CLE. So, this is the part where the fun starts. So, clinical learning environment is our laboratory space. It's our practical engagement where you will, every semester, whether you're in the Bachelor of Nursing or the Bachelor of Midwifery, you will be in the CLE space. In fact, if you're in the midwifery dual degree, you'll be in it more, but I'll let Kim talk about that later. So this is where we prepare you for clinical practice with practical skills. So the tutorials and the lectures, that's where we're doing the theoretical skills. But once we get you into the labs, we have, basically like wards. The rooms have like 5 beds. They have suction. They have oxygen. They have high fidelity mannequins in the bed. We can take observations on them. We can make them talk if we want to. We can give them medications. We can do all kinds of skills on them. So we use this to create real world practice. Like when you are learning skills, we don't just go in and practice this skill. We'll put it in context. You'll have patients with conditions and with lives, and you'll have to not just like take their blood pressure, you'll have to seek their consent, you'll have to talk to them, you'll have to engage with them, you'll have to answer questions they have that they may be very concerned about, to create that real world experience. And in some classes later on, we actually even bring in actors where you actually have to work with a trained actor, which is quite challenging. And it's actually a lot of fun because it's better to practice in simulated and on actors, because when you go out into the real world, suddenly you're dealing with real people and you've got to be able to communicate with them and you've got to be able to perform skills under supervision, of course, in these situations. And, over this course of the BN, we start with, again, the basic skills. You'll learn vital signs initially. You'll learn to assess. We'll talk about communication. By second year, we'll start doing some of the stuff like you'll start taking blood and you'll start doing more advanced drugs. You'll start putting catheters in people. And by third year, we're running full simulation cardiac arrests and patients who their lungs are filling up with fluid or they've got severe bleeding. I love this kind of stuff. I'm an emergency nurse, but it's fully supported, fully trained. So that's on the BN side. And for those who are in the dual degree, I'll let Kim add in all the extra fun.
Thank you. So obviously some of that is replicated while you're doing the nursing component of your course. For midwifery, we start in first year, as I said, in the second semester with Introduction to Midwifery. So that's getting to understand the philosophy of midwifery, what models of care are available, and starting to become familiar with some of the terminology surrounding antenatal, which is pregnancy, labour and birth, and postnatal, which is after the birth of the baby. So we start to utilise some of those terms so that they become more familiar to you when you commence into second, third and fourth year. Then within our CLEs, we will continue very similarly to practice a lot of the skills that you'll then be doing when you're out in the clinical workspace. So your placements will be usually antenatal clinic to start with, and then it will be rolling between birth suites and postnatal. And you will spend some time in special care nursery as well during the 4-year program. And so with that, we will do skills that are specific to those. If it's the neonates, we'll be doing things such as inserting nasogastric tubes, how we provide oxygen to newborns who are unwell, neonatal resuscitation, etc. For care of women, it will be the full journey. So how we provide antenatal care, education, how do we advocate for women on their journey of having their babies. And then we'll talk about normal labour, normal birth, pain relief options, choices in labour, where you may choose to have your baby. Will that be a hospital birth? Will that be a home birth? And what all those models surrounding care during your pregnancy, labour, birth and postnatal period may include. And that may be many of the midwifery practices that are available, midwifery group practice, caseload, private midwifery practice. It may be shared care between a GP or an obstetrician. It may be obstetric care, and it may be, rural and and remote type nursing as well. So it's quite extensive what the options are that we'll discuss and also be practicing throughout. And then we'll go on to some of the obstetric emergencies and work quite a bit of detail around how to manage an obstetric emergency, regardless of whether you're a midwife or whoever. It's the most suitable person that will be involved in providing that care. So our CLEs are fairly similar in wanting to practice and learn and make you feel confident for you then step into the workplace environment during your clinical placements.
I will just add with the CLEs that we also have, you can actually book out the CLEs and practice skills during the semester. So if you feel like we don't just do it once and you forget, we actually now you can actually book out labs and go, I want to practice these skills, and the team make sure all those skills are there. So a group of your friends can go and practice if you feel you need to. Then we move on to clinical placements, which to me is the whole point of doing this. You get to go out there and do the real thing. So to register as a nurse in Australia, you must have a minimum of 800 hours of clinical practice to become a nurse. In our course, in the Bachelor of Nursing, we actually do a minimum of 840 hours. So we actually do slightly more than you have to do, but that is what we want. We're going to give you more than you need. I'll quickly talk about clinical placements, and then I'll let Kim talk about the dual degree because there's extra with that. So with the Bachelor of Nursing, which will apply, of course, to the dual degree as well, you do your first placement in second semester of first year, regardless of which course you're in, and that is a 2-week placement, usually in a subacute type area to get you started. We don't throw you straight into the emergency department or something like that. You start a bit simpler. And you get your core skills. Then over the course of the subsequent years, you will do placements every single semester. So for the Bachelor of Nursing guys in second year, you do a 3-week placement in semester 1 for acute care and another one in second semester. And then somewhere in one of those semesters, you'll also do a 3-week mental health placement. And then in third year, both semesters, you do a 5-week acute placement, preparation for practice. So you're out there for quite a while. And we have a couple of different models that I won't go through tonight. But there's lots of clinical placements, and we have our placements are with the big hospitals. We have agreements with most of the big hospitals on this side of Melbourne. So, we commonly go to Monash Health, Eastern Health, Alfred, we go to Peninsula Health. We go to some of the big privates like Cabrini, we go to Epworth, lots of big hospitals. And we are constantly in contact with them. They tell us what we need to improve, the learning, so that we get that nice synergy between theory and practice and placement. When you're on placement, we're still in constant contact with the hospitals. You're not just forgotten because we want you to do really well. And Kim, you want to throw in there?
So very similar, as you can see there, it says that's 140 hours plus in midwifery. And with nursing, it definitely is midwifery. It's much more related to meeting your requirements. So not only do you have clinical placement, which may be in blocks of 2 or 3 week blocks, but it may also be integrated. So it could be 2 or 3 shifts per week that you may attend. But we also have quite a number of requirements that you need to fulfill as part of your registration with ARPA and to meet the requirements of the Nursing and Midwifery Board of Australia. So for some people that's achievable in those 840 hours, but there are many students that do in excess of that and do require additional placements to be able to meet the requirements, such as requiring 30 births where you're the primary midwife involved in those births, and 100 episodes of care in the antenatal period and in the postnatal period, and quite a number of other things that I'm certain our past students and current students will be able to fill you in more detail about as we progress on. We also have certain competency requirements that need to be completed and signed off, and there's 26 of those in total. So of course that depends on opportunity to be able to complete or achieve those. In addition, we also have what's called continuity of care experiences, and each student midwife is required to recruit a minimum of 10 women, and these women you will meet through different avenues, and you become like a buddy and a support to those women throughout their journey from their antenatal period through their labour and birth for at least 6 of the 10 of those women, and for postnatal care as well. So you will be required to attend a minimum of 2 antenatal or pregnancy visits during that continuity experience. As I said before, at least 6 of the 10 labour and births, and then 2 postnatal visits, whether they be in the postnatal ward, whether they be visiting when the woman and her baby go and see the maternal and child health nurse. And then there's a process to be able to write those reports up to make them meet the requirements for registration. Our placements predominantly are hospital-based and can be metropolitan and or rural. And we do have times where we do simulation for midwifery. We have some simulation within our CLEs, but we also run some simulations in collaboration with Monash Medical Centre with the medical students, where we run programs both on normal labour and birth and also on complications or obstetric emergencies. And these work collaboratively with our midwifery students and our medical students to work together and learn about those relationships of working cohesively together and communicating well together.
Just to add from the chat, people are starting to put questions in the Q&A. Thank you so much. Some of them are getting answered as we go. Some of them we're flagging to answer live. So please put your questions in so you don't forget the question and don't ask it at the end. So moving on to life and community, because it can't all be about study. Monash has so many things going on all the time. There are so many clubs and societies. It is amazing. Just come on, orientation week, and you will be amazed. There are clubs for everything. There are so many different clubs. The 2 listed here, MNMS and NSS, are the 2 nursing clubs. So MNMS is the Peninsula Monash Nursing Midwifery Society, and NSS is the Nursing Student Society. So NSS is Clayton, MNMS is Peninsula, but they're social clubs. The MNMS has an annual ball. There's all kinds of things going on. But even outside the student clubs, there is amazing what's going on. I came and there was debating clubs, and there was an anime club, and there's a Harry Potter club, and there's a club for I swear there's a club for everything. And if there isn't a club for everything, they will make one. Then we have our student reps. Actually, I might skip to peer mentors, and I'll let Kim talk about student reps since that's her area. Peer mentors are senior nursing students. So they're like students who are further through who actually donate their time to assist students, like first-year students, with the coursework, especially things like the bioscience, which can be really challenging, which is really great. It's great for, first years to have some, some third years or some fourth years helping out. Plus, it helps the third and the fourth years to consolidate their own knowledge. So not only are the academics helping you, but students are there to help you too. Kim, did you want to say something quickly about student reps?
Yeah, so our student rep committee, we meet quarterly at the moment. It is an opportunity for students of all year levels across both campuses to come together to discuss any issues for their student group population, so that we can try and resolve those issues, whether it's within that group or whether we need to engage other parties to either attend the meeting, or for myself and my co-chair to link in with academics to gather further information and meet a resolution. So it's a really great opportunity for your voices to be heard, as well as that building those relationships and additional skills to help you on your journey, both as students, but as you progress on in your career. Thanks, Chris.
Oh, do you want to answer this? Just introduce the students. I'm just answering a question in the chat.
No problems. So I guess we'll now go to some of the questions that we have, if that's okay with everyone. So first up, Georgia. So you are a graduate from the Bachelor of Nursing and Bachelor of Midwifery program. So the first I'd like to ask you is, what did you enjoy most about your degree?
Yeah, I had a bit of a think of this, and there are a few things that really stuck out when I was asked this question. First of all, was the meaningful interactions with women and patients while on clinical placement. So, when you're a student, you do have that luxury of having a little bit more time than what the registered nurses and midwives do. And if you can really take the opportunity to build a connection with your patient and your woman, learn about their history, learn about what they've been through, it makes a really much more meaningful experience for yourself and for them as well. I also really enjoyed studying with like minded people in the degree who had very similar values to me, and I've built some long lasting friendships. And finally, the hands on experience of placement was really, really helpful, as well as the learning about the science and the mechanisms of how the body works, especially in first, second year, was really interesting.
Fantastic. So it sounds like it's been a great opportunity and great journey for you, Georgia.
For sure.
Now I'm going to get you a little bit on the hop here as well, Georgia, just to ask you as well what your pathway was towards entering your degree as in the Bachelor of Nursing, Bachelor of Midwifery, if you'd be willing to share that journey.
For sure. So I graduated high school in 2018, studying BCE subjects such as English, general maths, physical education, health and human biology. So I already had an interest in the human body and science and how it all worked. I actually didn't know what I wanted to do when I finished school, so I took a gap year in 2019 and just tried to work part time and figure out what I wanted to do. Monash always stood out for me with its fantastic reputation for health sciences, so I was definitely gravitated towards that. And what led me towards, I think, the nursing and midwifery dual degree was the variety at which I could specialise in this degree, as I still wasn't 100% sure what I wanted to do, but I knew that if I studied to be a nurse and a midwife, that gave me unlimited options to go into different things.
Fantastic. And clearly you are very happy with those choices that you made.
Yes, very much.
Well done, Georgia.
Thank you.
Now, Sammy, I'd like to just ask you a question. So you are a BN student at Monash. So what types of things do you study in your program?
So over the course of the nursing program, we study a wide range of topics that build up year by year. So it's integrating more complex knowledge as we go. So in the first year, the focus is more on laying a strong foundation. So we start by learning about organ function, human anatomy, and some basic biochemistry. These subjects help us to understand how body works normally, and also we begin developing some essential nursing skills as well, like taking vital signs, performing assessments, making beds, and giving bed washes. We also study some healthcare ethics and gain an understanding of indigenous health, which is vital in providing culturally safe care. While in second year, the content become more clinical side. So we study various diseases, including their causes, pathophysiology, potential complications, and the nursing management. We also explore the treatment options, medications, and the nursing role in managing different conditions. And also specialties like mental health, oncology, and pediatrics are also introduced during this year. Practical skills become more advanced as well. So we learn to administer medications orally by injection or intravenously. And we also trained in venipuncture, like taking bloods and caring for patients with different types of tubings, like nasogastric tubes, drain tubes, and the anesthesia pump. And to third year, we focus on managing more critical and complex health conditions like sepsis, meningitis, and heart attack. a major emphasis is placed on recognizing the early signs of deterioration and taking a timely action. We also learn how to care for elderly patients with multiple chronic conditions and with a strong focus on safety and our quality of care. And across all these 3 years, we continuously develop our soft skills like communication, teamwork, and problem solving, which are essential traits for any nurse in practice.
Yes, so you have given us a very thorough and in-depth understanding of the program, so thank you.
That's okay.
Megan, if I can ask you, so you are a grad from the Bachelor of Nursing program a few years ago now, so you've been out in that big wide world for a little while.
I
So
sure
can
have.
I ask you, how did you manage studying within the course as well as the requirements of clinical placement?
Sure. So when I was managing my coursework at Monash, I found the best thing that I could do for a solid foundation was to prioritize planning and self-care. So time management was really important for me. So I had a calendar at all times. One of the good things about Monash is that they're so organized. So you could look up the clinical placement schedule ahead of time if you knew your what you were going to be doing, and you could go ahead and actually plan around that, which was really helpful. Assignment deadlines were always given to you at the start of the semester, so when a semester would start, I'd collate all of those deadlines into an A4 document and put it up on my wall, pick them off one by one. This was really helpful to make sure that I wasn't missing assignments, so that my workplace could be ready to go. Keeping organised with my lecture notes and readings were really important as well, so that I wasn't falling behind in coursework while also doing placement. I think for any students, I would recommend communicating early to educators if you're struggling, because they're always there to support you in your learning, and they want to make sure you're understanding concepts. Forming study groups are also really good. So I think in my third year, there was a few of us that got together and we would study. But yeah, just looking after yourself, prioritizing sleep, nutrition, food, and downtime to keep mentally sharp. Yeah.
And I think there's some fantastic tips that you've discussed that help you to survive the ups and downs and all the challenges that you faced with that balancing act between studying and being out in the workforce as well. So thank you so much, Megan. Georgia, I'm going to just ask you as well to just cast your mind back as a student, and equally, how did you find midwifery clinical placements? And I'm quite happy for you to extend into also balancing nursing placements in that as well. And what did you enjoy most about placements?
Yeah, for sure. So doing both the midwifery and nursing placements can be really challenging, but it's definitely rewarding because you get such a large scope of practice and experience in it. I loved in the midwifery placements the women-centered care. It was by far my favourite bit of placement, being in a birthing room with a woman for 8 hours and building that rapport and really being able to connect on that level. Even if they didn't birth the baby on that shift, you could tell you really made a difference. So I found those aspects of placement really rewarding, where I could make a difference to how that woman felt. And I think you'll hear a lot of the time that people won't remember what you do, but they'll remember how you made them feel. And I think that's a really good tip to take with you into your placements. So that's probably what I really enjoyed.
Fantastic, thank you. And Sammy, I'm going to ask you similar questions. So how did you find your nursing clinical placements, and what parts of placement did you enjoy the most?
I actually enjoyed all of my clinical placements so far. They really give me the chance to practice my hands-on nursing skills in the actual clinical environment. So each placement have really helped me to grow a lot, and it's not just in the practical skills, but also in the confidence and critical thinking skills. The nursing staff I've worked with have all been so supportive and willing to help, and I've learned so much from them. So far, I've had placement in aged care, residential services, oncology, surgical units, and acute mental health wards. And each area have its own unique challenges and learning experience. I'll admit at first it's pretty confronting, especially during my time in oncology. Experiencing patient death for the first time is pretty scary and emotional. But over time, I came to understand that what matters most is making sure patients are comfortable and receiving the best possible care, especially towards their end of life. Knowing that I could help to make someone's final days more peaceful, give me a sense of purpose and remind me why would I choose this profession. What I enjoy most is the interaction with my patients. Seeing their smile and hearing their stories really inspires me, and they make me understand the importance of being resilient and optimistic. I also love that after each placement, I feel like my nursing knowledge is consolidated, not so it's no longer just theory, but it's something that I can apply and understand in real situation. And that sense of achievement and knowing that I've made a difference is what makes placement so meaningful for me.
That's fantastic, because that's what we want for you both to be able to achieve, is to be able to translate that theory into the practical situation and recognise what a privilege it is to work in the areas that we work in. So thank you, Sammy. Megan, can I ask you, what are some of the challenges that you faced during clinical placement and during the degree, and how you were able to overcome those challenges?
Sure. So one of the main challenges I faced during my degree was adapting to the different protocols and processes during my clinical placements, as we always seem to move between hospitals. This made it difficult with my confidence as any young student nurses, learning the skills and, being in different environments. However, I was fortunate enough to be accepted into the Monash Peninsula Fellowship Program, being a student from the Peninsula campus. This meant that I had a good continuum of learning, being able to go to Peninsula Health campuses and complete many of my clinical placements there. That continuity allowed me to become familiar with the hospital system, the workflows, the electronic medical records. It was, as a result, I was able to build confidence, develop stronger clinical skills, and engage in professional relationships that to this day I maintain as I work now there as an employee, not attending as a student nurse.
Yes, so fellowship is certainly an option that may be available to some students, and certainly that is what students that take that option articulate. But it is also part of it is learning that there are very different ways for doing very similar things from one health service to another. So that builds growth and resilience and knowledge as well. So that's really good. Thank you. Sammy, so you've already touched on them really quite well already, but what are some of the core skills that you've developed during the degree so far?
So throughout my nursing degree, I've developed a wide range of core skills that essential in clinical settings. So we have several units specifically focusing on communication and leadership. So we work on group projects and some assignments. And this experience helped me to apply theories from the journal articles and taught me how to work effectively in a team and listen actively to my group mates. Outside of classroom, my role as a student representative also helped to strengthen my problem solving and communication skills as well. In this position, I'm responsible to listen to student concerns, escalating issues to academic staff, and help to find solutions. It really pushed me out of my comfort zone, especially as an international student whose first language isn't English. It's really boosts my confidence in speaking up and engaging with others professionally. I think time management is another key skills that I've developed. Balancing lectures, assignments, exams, and clinical placements require really strong planning and organization skills. Learning how to manage my time effectively has been essential not only for academic success, but also for me to maintain a healthy work-life balance and avoid burnouts.
Brilliant. Thank you. Very important points that you've raised there. So Georgia, can I ask you if you can give some tips for future students who are considering to do nursing or nursing and midwifery as a career, or to do the degree in either or?
Yeah, for sure. So the first thing I thought of is to not only have compassion for the patients, but compassion for yourself as well. What I found over the past 4 years is it's a very common personality trait of us who want to be nurses and midwives. We look out for everyone else and then are our own worst critic. So accept that you will make mistakes. You'll probably do things that you thought, why did I do that? And you'll overthink, but you've just got to be kind to yourself because no one learns, perfectly, and no one is perfect, and you'll always continue to make mistakes and learn. I would also say to advocate for yourself when you can, which can be really scary on placement. But if you have a feeling that something isn't right or you have a sense, don't be afraid to speak up and escalate. You should never be told off for escalating, even if it wasn't appropriate at the time, because they'd rather you be too cautious than not cautious enough. And if you were incorrect, then it's a great learning opportunity as to why that wasn't the right answer. And finally, don't expect every day to be sunshine and rainbows. It is hard. You'll have some confronting moments, there'll be some tricky moments, but that's what ultimately makes you a better nurse and midwife, is learning from those tricky days and being able to pick yourself up and learn how to, learn how to adapt and learn how to grow from those experiences.
Excellent. And I think you're right. We are all ongoingly learning in the profession of nursing and or midwifery. Thank you. Megan, so what opportunities were available during your program? Extracurricular things, travelling, etc.?
Yeah, sure. So when I completed my Bachelor of Nursing, something sort of dinged in my brain, and I decided to basically accept any extracurricular opportunity that came my way. So not only was I a part of the fellowship program at Peninsula Health, I was fortunate enough to be accepted into the Forensic Care placement program. All nursing students complete one mental health placement within their block that aligns with their study, and I was fortunate enough to go to the Thomas Embling Hospital up in the city to complete my forensic mental health placement up there. This was a male forensic unit, so it was quite interesting to be a part of, and I felt very fortunate to learn in such an important place. As well as that, in my second year, I was also a part of the Australian Primary Healthcare Nursing Association placement program. So I went to a local GP clinic, which was specialised. When I was there, I was exposed to triaging basic trauma, completing small day procedures, removal of BCCs, SCCs, as well as doing diabetes treatment plans and all sorts of different primary care things under the skilled team there, which I was very fortunate enough to do. Beyond that, I was also in my final year of nursing, what was formerly known as the Monash University Nurses Club, now the MNMS group. I was the president in third year. I was also a peer mentor as well, so I took time out of my third year to mentor younger students. In high school, I went to my local high schools where I once was a student and spent time mentoring two students who were interested in a nursing pathway to help them with their subjects. Beyond that, I enjoyed the snowboarding club at Clayton, going up to Clayton and heading up to the snow with all the people up at that campus and enjoying the fun that comes with that. But yeah, there was plenty of opportunity there that I definitely took advantage of.
It's fantastic to hear, and there was quite diverse opportunity for you, which is amazing. So that's really good.
Certainly, definitely for everyone. So you just keep an eye on your emails as a student and just say yes and go with the flow. You'll enjoy it.
Good point. Good tip to make. Good suggestion. Now I'm going to ask the last part to the three of you really, and any or all of you can answer, both as current students or as past students, of what you see life on campus has been like and all about.
I might jump in first, just as a former student. I studied while COVID was sort of starting. So in terms of campus life, I think that Monash did a really good job going virtual. I certainly hope that there's not a second pandemic, touch wood, that any of the students, prospective students here today have to come through. But there's certainly a lot of life on campus. With Peninsula, you can go and get a meal down at the Monsu Centre with the students down there, and there's a beautiful library and all that sort of stuff. And there's definitely a vibrant campus over at Clayton. There's shops, hairdressers, banks. You can go and, go play basketball or go to the gym. There's a lot to do on campus. But I'll let the current students extend on that.
Thank you, Megan. So currently I'm in Clayton campus. So I'm also living on campus as well because I'm an international student. So I feel like in Clayton campus, it's a really big campus. So that we have all the things that we need, like what Megan just said, like libraries and all sorts of shops and restaurants. We have everything. So it's like a little small community that students goes together. And also we get to have lots of different opportunities to go to clubs and societies events as well. Or even just staying on campus, we have many residential events as well, like the residential ball or many different activities that we can learn, like we can meet new people and stuff. So it's a really good experience.
And Georgia is a more recent student on Peninsula campus.
Yes, so what really drew me to the Peninsula campus, not only because it was the only place that offered the double, but I come from a regional area, and going to such a big university like Clayton was absolutely terrifying for me. And so it was really refreshing to go to Peninsula campus, which is much smaller. There's a bit of greenery. It's a really nice, peaceful environment. Similar to Megan, I started during COVID, so 2020. So both 2020 and 2021 were definitely different to what the normal uni experience would be. But I really enjoyed how Monash adapted, and I still think the support was fantastic. In my last 2 years of the degree, I did spend a lot more time on campus, mostly just for my CLEs and my classes, as I was quite a long commute, so I didn't live on campus. I would travel. But there was always, things going on, whether it be free food on a Thursday morning or clubs celebrating a fun game, and you'd always find that out via emails. And I did participate in a few of those things every now and then. It was really fun.
Thank you. That's really nice to hear your experiences on the campuses as students. Thank you for sharing those with us and the wider audience.
All right, thanks, Kim. Is that the rest of the questions that have already been answered? All right, so we do have a couple of questions that have been submitted live. Perhaps either Chris or Kim, if you would like to take this. So my understanding is when students get accepted into the Bachelor's of Nursing, we predominantly look at their ATAR. But what other qualities do you look for that makes a great nursing student?
So we're talking about a nursing student. We're not talking about enrollment, because enrollment is
Yes,
obviously
that's right.
ATAR.
So yeah, that's right. So enrollment strictly ATAR based, but what qualities do you look at for a good student,
Well,
nursing student?
I'll start off. The main ones I'll say is you've got to be able to engage with people. I mean, communication is key. It doesn't matter where you work. You've got to be able not only to engage with people, but engage with people sometimes at their lowest point, and hopefully with midwifery at their highest point. You've got to have good communication. You've got to have a desire to learn and be adaptable. One of the things that's hard with nursing, especially since I came from a maths science background, is there's no formula for nursing. I can't, if we get 5 people with the exact same problem in 5 hospital beds, 2 of them will have terrible pain, one of them will develop a fever, the other one will have terrible rehab. So you've got to communicate, you've got to be adaptable, and you've got to like working with people, because it's a very customer service oriented profession. Kim, do you want to?
Yeah, and I think there are very many similar things for midwifery as well. But in addition, for midwifery, we are in a very privileged position, and the majority of the time it is a very joyous time, but there are times when it's a very sad time as well. And to be adaptable to that and to be able to, show compassion and empathy for women and families during that time. Midwifery is very much more, sort of woman-centered, not so driven by the disease process and things potentially going wrong. Not that we're saying they don't, because they still can. So philosophically, it focuses a little differently. But I think it is about having a really strong desire and passion to work with women and their families. It's not just caring for babies, as we often hear people say, and being a really strong advocate for women and women's health, and to be able to, to walk the journey alongside the women and their families.
I think with this question, I just want to check, do our grads and students want to throw in any key criteria that we've missed?
Absolutely.
I would definitely say strong communication skills. Even if you find yourself introverted, there's a lot of interdisciplinary collaboration. So, it's not just nurses working with nurses, it's nurses working with doctors and allied health and clerical staff. So, realizing that you're, in the ecosystem of healthcare and being able to work amongst other people and communicate and advocate for your patients and be there to support them. Those are all really important things as a nurse that you've got to be able to do, and get comfortable, sometimes being uncomfortable.
Thanks, Chris and Kim. So we move on to our next question before we conclude this session. We did cover the key features of the Nursing Scholars Program, but we did have another question asking about what are the differences between the actual degree versus the degree with scholars? Like, what additional benefits are there?
The course itself is the same. You'll do the same units, whether it's BN or BN scholars. Scholars just get extra opportunity, extra sort of almost like extracurricular activities, involved in things around leadership, research opportunities. There's just some extra things that are made available just to the scholars program. I have one of the academics who runs the scholars program, and they run opportunities every semester, which are only offered to the scholars program students. But at the end of the day, your coursework is the same, because being an RN is being an RN.
All right, thanks, Chris. All right, so we did have another question here in regards to entry requirements for nursing and the nursing and midwifery, so I'll just take that. So we pretty much just look at your ETA. There are no requirements for an interview or CV or anything like that. All right, so to conclude, perhaps if either the current students or graduates would like to share, some tips for students who are considering the degree in the future. Maybe Megan or Georgia, do you want to go?
Just to clarify, the nursing degree.
Oh,
just
yeah,
university,
that's right.
tertiary stuff.
Nursing or university life in general.
I think if you're looking at pursuing tertiary education, have a chat to people in your life who have gone ahead and done it. Know that there's flexibility. So if you find that you start a unit that you might not love, or a degree you might not love, that you can change, and there's room for wiggle. If you start off with an ATAR you're not happy with as a student, you can always move universities. I certainly didn't start at Monash, but my goal was to finish at Monash. So I completed a year of university somewhere else so that I could transfer into Monash where I wanted to finish off. I think that it's really important to be forgiving to yourself as a student and give it a red hot crack, which seems like the younger generation are definitely keen to do. So go ahead, be brave and learn lots.
Thanks, Megan. Georgia, do you have anything else to add?
Yeah, I think Megan's really said it all. I think just be kind to yourself. Don't put pressure on yourself to be perfect, and don't stretch yourself too thin. We're all human. None of us can do everything in a day that we want to do. Sometimes it's just the way it is. And yeah, like Megan said, there's flexibility. If you sign in something, you're not locked in forever. There's always different options to diverge here and there if you want to do something different. So just have a go and take each day as it comes.
Thanks, Georgia and Sammy. Before we wrap it up.
I think Georgia and Megan have pretty much covered everything, but also I feel like it's this course is really meaningful to me, especially I get to learn a lot, and I also explored that nursing is actually a really meaningful and give me a really great sense of achievement career. So it's a really great opportunity for you to figure out what you actually want, and yeah, don't get too stressed about it, especially there's many different pathways that you can get into this course as well. Yeah.
All right. Thank you, Georgia, Megan, and Sammy. Chris and Kim, do you have anything else to add? If not, I may end it here.
I was going to suggest with pathways, Kim, there is a question about nursing to midwifery pathways. Do you want to mention the nursing midwifery pathway within the course?
Yes, I can quite briefly. So I alluded earlier that the first unit for midwifery does not start till semester 2 of the first year of the program. So that's an opportunity, where that unit is compulsory for those who are already in the Bachelor of Nursing, Bachelor of Midwifery program, and an elective unit for Bachelor of Nursing. But it's also an opportunity where people that are in the Bachelor of Nursing may decide that they would like to transfer across to the Bachelor of Nursing, Bachelor of Midwifery. There is an application process. You do have to exceed in your academic studies within the midwifery unit in second semester, and then there are a select number of people that will be transferred across or offered the opportunity to transfer to the dual program at the end of first year.
All right. Thank you, Kim. Yes, Chris.
I was just going to say, I'm sure you're probably going to cover it anyway, but I really encourage people to come to the open day this year and, come and see us. We'll be there, see the labs, see the place, see what it's like. I mean, we can tell you about the CLEs and we can tell you about how big Monash Clayton is, but you got to experience it. I mean, Monash Clayton's got its own postcode. It's pretty big. I'm still
Yes, that's right.
places.
Yes, that's right. So do come by open day. I've just popped the link in the chat function as well. Feel free to attend, register, and just a reminder that nursing and midwifery is only offered at Peninsula. So if you are looking at doing midwifery, definitely check out the Peninsula campus, which is on the Saturday, and on the Sunday, there'll be the Clayton campus. All right, thanks everyone, and have a good night. We'll end it right here. Thanks everyone.